Welcome everyone to today's webinar, How Digital Transformation and a Smart IoT Infrastructure Solve Critical Healthcare Problems. On behalf of Becker's Healthcare, thank you so much for joining us today. Before we begin, I'm going to walk us through a few quick housekeeping instructions. Number one, we'll begin today's webinar with a discussion and have time at the end of the hour for a question and answer session. So you can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is also being recorded and will be available after the event. You can use the same link that you used to log into today's webinar to access the recording afterwards. Lastly, if at any time you don't see your slides moving or have trouble with the audio, please try refreshing your browser. You can also submit any technical questions you have into the same Q&A box. We are here to help. With that, I'm so pleased to introduce today's speaker, Kapil Asher, who is the head of healthcare practice with Kontakt.io. So Kapil, thank you for being here today, and I'll turn the floor over to you to get us started.
Hey, thanks, Daniel. Good morning, good afternoon, good evening. I know this webinar is being watched all over the globe, so I wish you all the very best. Let's start with today's topic. Most of what we're going to talk about is how to improve administrative operations of hospitals, right? Until now, health systems were investing heavily on the clinical side of things, but neglecting the administrative sides of hospital operations vastly. So if you look at any stats that show how much hospitals are spending on administrative operations, it all talks in about $250 to $275 billion, right? And this is a sharp increase of about 21% in the last few years. I think if I'm correct in my stats, it's in the last 7 years or so. There has been an increase of more than 21%, which is staggering when you think about it, right? So what gives, like, why are these costs so high? What are some of the top reasons why hospitals end up spending so much money? And the first thing that comes to mind is capital asset wastage. So high volume equipment like infusion pumps and other medical devices, which are typically utilized in the 30 to 40% range. And the rest of them are just sitting idle, not being utilized. So hospitals spend vast amount of capex buying these equipment to serve their patients. And then they end up spending a lot on the OpEx of taking care of these equipment, maintaining them, making sure they're calibrated. And then just helps with the staggering cost that I mentioned earlier, right? Clinicians, including nurses and physicians, spend most of their time on administrative tasks around the medical devices, and all results in poor productivity, even including our biomed group, the clinical engineers that are tasked with maintaining them. All of this, if you take an example of a simple 650-bed hospital, they lose about $5.8 million in poor medical device management. So coming back to like the operational side of the health system, has always been neglected. It's never been digitized. A lot of manual efforts, a lot of administrative tasks that take time away from core patient care is affecting the costs. The second and a more important reason why costs are staggering is the nurse turnover. So in the past few years since the pandemic, maybe 20 to 30% nurses are turning over each year. And this is highest healthcare staff shortage in modern history. At any given time, almost 8% of nurses are just quitting the career altogether. They're finding other career avenues to progress their lives with, and they're just stopped being nurses. And not that they're greedy or they're finding ways to get out of their the core job that they were trying to do. It's just that they're just overworked. They're burdened with a lot of menial tasks, a lot of administrative and manual tasks. And there's a massive lack of automation and digitization, which could help them be more productive, right? Not only that, about 42% of nurses in US reported workplace violence last year. So if you just go on the OSHA website and read up on the stats of how nurses are, or how workplace violence has increased in the past few years, the top industry that faces this issue is healthcare. And nurses being right in front of patients and loved ones are vulnerable to such attacks at all times. So nurses feel like, why am I putting my lives in danger? I could be doing something else and utilize my time and make the same amount of money somewhere else, right? So that's kind of some of the reasons why they are quitting or turning over. Now, when your nurse force shrinks, you have to backfill them with traveling nurses, with contract nurses, and typically these cost about 2 to 3x of in-house nurses, right? So there is higher hourly rate where you purchase these services from third-party contracts, and it just affects your bottom line significantly. And at the same time, you can't work with reduced nurses because it affects the nurse to patient ratio and reduces your quality of care. And if anyone who's in the healthcare industry understands how HCAP scores work, if your patient's quality of care is reduced, you get a negative feedback that could affect up to 3% of your Medicaid reimbursements, right? So this all spirals into a massive problem. Which affects the operating margin of hospitals, typically which was floating in about 5 to 10% are now shrunk below 2%. And what are the reasons? Not only is the nurse turnover, the capital asset management issues are adding to the cost, but in the past few years, there's also been lower volume of patients that affect profit margins of the hospitals. Um, like the emergency department visits have gone down, the operating room visits have gone down. These are kind of the profit centers of the hospital where maximum amount of revenue is made. But due to the pandemic, these volumes have gone down in the past 2 or 3 years. And on the flip side, inflationary issues with increasing labor cost, increase in supply chain costs, all of this is eventually increasing the cost to a point where the margins have shrunk significantly in the past few years. Now, patient experience is always at the center of all of this. When you are burdened with high administrative costs and trying to combat that, the main sufferer of this issue is the patient. Of course, the sufferers are also the staff members who are offering the care delivery. But at the end of the day, patient is the customer of healthcare, and poor experience because of these staggering administrative costs and bottlenecks affect the patient, and it reduces reimbursements and spirals into a lower margin problem, which I was just talking about. How does patient satisfaction affect hospitals? Right. So think of bottlenecks. You go into an ambulatory center or an outpatient clinic, you face with high wait times. It sometimes just makes sense for the patient to just return and go back home rather than waiting for an hour, 2 hours just to get a 15-minute examination done, right? So this has a metric of reducing patient intakes by 20%. There are issues with elopement. So think of Alzheimer's dementia patients. They have a problem with wandering. They're going into areas that could put themselves or others at harm. And this has cost over 6,000 deaths in the past 10 years. And then finally, doctor's appointments are being missed. So about 16% of doctor's appointments were missed in 2021, resulting in a $3 million problem per clinic, right? And why do patients miss appointments? Usually they come in, the hospitals and the outpatient clinics are huge and they have no idea where to go. So again, because of their anxiety, because of lack of asking for directions, they would just turn around and go back home, right? So we are trying to make sure that the patients are coming in, their satisfaction rates are really high. We are helping with kind of putting patient at the center of this whole operation, so that when they leave the hospital, they feel satisfied and their experience has been as good as any consumer grade service like a hotel or a restaurant is being achieved even by health. So how can Kontakt.io help? I mean, we spoke a lot about the problems, about the staggering costs. What can Kontakt.io do to help with this, right? There is I think there was one slide which I missed talking about, but as I opened this conversation, this was clinical side of hospitals have always gotten the best of best breeds, right? Think of all your shiny MRI machines, the progress that's made over there. Think of all your, the progress pharmacists have made with providing the best medicines and drugs to help with patient outcomes. But no one's paid attention to the administrative side of hospitals. So when you install products, when you install solutions to solve one specific problem, they're all sitting in silos where the data is consumed only by that system or that solution without being shared with other systems within the hospital, right? So things like real-time location sensing, IoT, those buzzwords have been amazing, but the problem is they've never been able to share data in a manner that provides efficiency across the board, not just for that specific problem that the hospitals are trying to solve, right? So I feel like Kontakt.io is not solving one point solution. We are actually creating a completely new category of technology where we consolidate siloed data from multiple avenues and focus on blending efficiency with quality experience. And I'll explain how we do that in the next few slides. But we're almost to a point where we are not competing with an IoT provider or an RTRS provider. We are almost creating an absolutely new technology category by how we operate within these health systems. How do we begin, right? So step one is start with equipment, right? As I mentioned earlier, equipment, capital assets are taking over a lot of those staggering costs that we were mentioning. I think it's time to get a grip on those equipment by reducing overstocking. So when high volume equipment like infusion pumps are utilized only at 30% capacity, the rest of the 70% devices still require maintenance, still require payments, still require software licenses. And those costs are absolutely wasted. They're not going to be recouped at any given time. So what we do is by providing a solution where our technology provides information about just-in-time inventory. Our AI tells the health systems how many pumps would you need to meet the most surge in demand as well, right? Not just low demand times, but also when there's a high surge in demand, what is the quantities of IV pumps you would need to make sure you have them just in time and you're not overstocking, right? So optimize your fleet to a manner where it's not affecting your performance, but at the same time, not staggering on the cost side as well. Then we can prevent loss proactively. It's very common for hospitals to lose $3,000, $5,000 worth of telemetry packs because they get wrapped around in linens, they get lost in trash chutes, and they're never retrieved again. So by proactively avoiding those losses, we can give money back to the hospital by avoiding purchase of equipment to replenish the loss. Then we also help with regaining control over rental equipment. So you would hear all the time that we have enough beds, bariatric beds, wheelchairs, we have SCDs, moonwags. But sometimes when the surge is high, when the census is really high, we still end up renting equipment from outside. And what happens to the rental equipment? If that's not being sent out on time when the lease period ends, you're racking late fees. You also have to maintain them if they are there for longer than the manufacturer recommended preventative maintenance cycle. And overall, it's a bad practice to have to rent a lot of equipment from outside. So by providing location services around it, by providing automation of workflows around the rental equipment, we can make sure we send them out on time and eventually even avoid rentals completely, right? And then help with the productivity of clinical engineering, help with the productivity of nurses so that they don't have to spend time manually searching for equipment. By just click of a button and some simple searches, they know exactly where things are located at any given time. So by just doing this, we are helping health systems of the size of a 650 bed hospital unlock savings of about $5.8 million annually, right? So once we get a grip on capital assets and make some money back for the hospitals, we can think of how else can we use this saved money. The step two in our quest for improving efficiency is optimizing space. So think of your exam rooms, think of your acute care centers. Without knowing how space is utilized, it is very difficult to provide efficiency. So a simple example comes to mind is when you have a floor with, let's say, 8 to 12 exam rooms, and if you don't have any idea of which rooms are occupied, how many patients are within your space, are nurses assigned to the right exam rooms at any given time, you would be doing yourself a massive disservice. And on the flip side, if you have excess capacity, right? If you don't know that you have excess capacity, you could be losing out on excess patient intake. So let's say your facility can do maybe 20 visits per day, but because of lack of data, because of knowing how well your space is being utilized, you are taking only, let's say, 17 patients per day. That's 30% top line revenue just lost for that day. So by providing analytics on how space is being utilized, we can enable real-time decision making. We can avoid bottlenecks. We can avoid high wait times, and optimize your space to increase your capacity of that exam room. Then the third part is making sure that your workforce, especially nurses, are being productive and healthy at all times. Now, I mentioned the word healthy is because there is this notion of hospital-acquired infections, where nurses acquire infection from their patients and God forbid, transferred it to other patients, which increases their length of stay, which is not reimbursed by Medicare. So it's very important that the HAIs are reduced, your staff is healthy and in good operating condition at all times, which also means protecting them against that workplace violence, which I was mentioning before, by giving them sort of wearable panic alarm buttons so that when they are facing imminent threat, which could be minor or major, they can call for help in a very fast manner. And they're not stuck facing that situation on their own. They may or may not be trained on how to face that situation. So in this way, by providing them with these wearable panic alarms, they can, with a click of a button, call for help as soon as possible, and the situation can be dealt with in an easy manner. And then let technology provide efficiency in laborious workflows, right? So, for instance, if there is a situation where nurses are not spending enough time with patients because they are burdened with some manual labor, our systems are helping them automate some of those workflows so that they can go back to doing their core job, which is spend most time with the patient bedside and deal with the patient requirements at that point. So by starting with the assets, then going to the spaces, and then working towards staff productivity, we can focus on patient experience, which is kind of core of all decisions, right? So at Kontakt.io, we are using analytics to understand how patient journey goes on at the time when the patient comes in, they check in, and all the way till the discharge. Why we are kind of creating an orchestration of resources that the patient will end up consuming for better care, which could be medical devices, like I mentioned, which could be nurses, like I mentioned in step 3, and also with the space, making sure that there are rooms available for the patient when they are needed. There are lab spaces available for the patient when they need to go get a radiology done or blood drawn. All those things we are orchestrating within our ecosystem, right? And Kontakt.io cannot do it all alone. And I don't think any other system can do it all alone. This can be done only when there is openness in data sharing. So using APIs, we integrate with systems like asset management or CMMS and collect data from them on when the next preventative maintenance is due. Is the medical device clean or soiled? Are the medical devices are going through an end of life situation? What are the available nurses that can help with this core functionality that the patient requires? Is the OR ready to use? Is the OR turned over in the timely manner? All those things are important for the data collection piece so that it can all come together and help serve the patient better. If I would give an example of a more commonly known industry like the airlines, right? If you have a airline app on your phone, it's not just the airline app providing you with data. They are actually collecting weather information from the local airport geography. They're collecting information from the airport itself to know where is the closest restroom, what kind of restaurants are open for the traveler to go, have a snack or drink a water or something like that. So without collecting data from all these multiple sources, they're not able to provide the traveler with that experience that they deserve, right, for that travel piece. So it's a very similar situation with healthcare. We are collecting data from EMR, from CMMS, from building management services, bringing it all together so that the patient experiences something of a consumer grade and not just something from an archaic hospital that is just there to serve them, right? All of this is kind of being utilized to create a balance between quality of care and operational efficiency. So if you look at this graph over here, if you are just focusing on operational efficiency, your quality of care might not be as good. Or if you're focusing just on quality experience, then it's the operational efficiency is kind of being suffered. You can't balance both of them together, which is where Kontakt.io comes in and kind of fills that gap in the industry right now. How do we bring it all together? I mean, there have been a lot of big words being used over here. How do we bring it all together, right? So like I mentioned, we provide this patient journey orchestration by mapping data from various systems and not siloing data within our own ecosystem. By providing location service, by providing not just location service, but plug and play location services. So we provide location data on medical devices, staff and patients using kind of infrastructure that is simple plug and play, doesn't require any cable pulls or wiring, none of that. It's either battery operated or just plugs into the wall. And we are also integrating with advanced enterprise infrastructure like the Wi-Fi, like smart lighting. So whatever is available at the health system for providing location services, we are connecting with them and creating this ubiquitous mapping of physical locations of devices, staff, and patients. So just think of like plug and play and not requiring massive infrastructure investments. Then finally, apps that drive rapid adoption. So whatever I'm mentioning up to this point, where we integrate with other systems, we open our data, to get there, it takes some time. And to get there, you need buy-in from our end users. Otherwise, we would never be able to get there. So what we do at Kontakt.io is we provide apps that drive rapid adoption out of the box and part of our offering on day one. It's not like you invest in the infrastructure and then think of putting these apps on. Our deployment will include the infrastructure and the location sensors and have these apps enabled on day one. And these are apps that our end users love to use on a day-to-day basis, and it's providing them with a value that will help them drive adoption rapidly. We bucketize these apps into three major domains. One is the staff workflows. This is where we provide, the wearable panic alarm buttons. There are these dashboards which show when an alert is coming from a staff member, so that the alert can be responded to in a rapid manner, and not only the response to the alert, but also documenting what that alert means is also automated within this app, right? So the security officer or the responder does not have to worry about writing reports on what the situation was. It just gets automatically stored within the database, and you can pull that report in a future session when either Joint Commission or DNV comes in and asks you information about what that panic alarm entailed. Same thing with medical devices. We have carved out apps that solve specific problems, but are still part of the Kontakt.io ecosystem, the cloud ecosystem, like the wheelchairs, like the IV pumps, like the telepacks, which provide you with automation in the workflows, like how IV pump is such a cyclical workflow. It goes from a patient room to a soiled room. From the soiled room, it gets cleaned and stored in a clean area, and then used back in the patient room. By automating those different phases of the journey of the IV pump, we are providing its utilization, we are providing the demand of the IV pumps, and then by using that real-time data for 3 to 6 months, we can start suggesting what the values of different power levels in different areas should be. So you're optimizing their usage rather than overstocking them and having them underutilized. Same thing with wheelchairs. Wheelchairs is the first thing when a patient comes is kind of needed at the doorstep. And if you don't have a wheelchair at that point, then you are causing a poor experience even before the patient enters the building, right? So making sure the wheelchairs are stocked in the areas where they're needed, making sure they're dynamically available depending on the demand for the day is something that our apps provide natively. And then finally, the patient experience apps. Our wayfinding app is one of the ones which comes to mind, making sure that when the patient comes in, we are providing them with an indoor navigation app to get them to their appointment in a timely manner. Now, that patient experience makes sure that the patients don't miss their appointments, but at the same time, it saves some time on the hospital staff as well, right? Because every time a patient comes in and asks for directions, it's taking away some staff members' time from what they have been tasked to do. So not only we are improving their experience, but we are also reducing the burden of manual tasks on the staff at the same time. So these patient experience apps, think of digital signage or kiosks. When they come in, they can check in using the kiosk. They can get a location tag from there on. All the steps of their journey from entry to discharge is being recorded by us by Kontakt.io. So you can identify the bottlenecks and make sure those bottlenecks are reduced over time, and they are passing through different phases of care in a much efficient manner. So just to summarize, you start with apps that drive rapid adoption and start looking and capturing ROI from them. And once you capture some ROI, make some money back from the investment that you made in the Kontakt.io system, you can fund other initiatives, which I'll talk about in a little bit. So let's just take this ROI example of simply pump utilization. So 6,500 bed health system in the Northeast that has roughly 20,000 pumps. if we're being generous over here and giving them a current average utilization of about 40%. And with our systems, we can improve our utilization by 20% to 60 and save 6,500 pumps that are not needed by that system. So what would require 20,000 pumps? We can do the same job with 13,000 pumps and save roughly 6,500 pumps for this health system. Now you can take these 6,500 pumps and either redistribute amongst other health system, other hospital facilities within your ecosystem, or you could even sell it in the used pump market, or you can reserve it as a future, right? If so, when actual pumps break or they are unusable, you can pick a pump from the reserved stash rather than going out and buying them. So by just avoiding capital purchase, you can save about $23.4 million. And then over 5 years, you can save in biomed productivity, you can save in support staff productivity, the ones which are transporting pumps from the clean to soil to patient rooms. And you can even avoid equipment loss. Believe it or not, even IV pumps get lost from time to time and you need to replenish them with new ones. So by improving the productivity, by avoiding loss and capital purchase, over 5 years, that results to be a $58.1 million savings. And when you look at the investment in our system, it could be a 8x ROI, which you can get within 6 months after go live. And this is not an exaggeration. This is kind of industry agreed upon numbers, and this is how we can unlock those savings for health systems across the whole country. Let's take another example, staff safety. So like I mentioned, when staff members get injured, they go on short-term leave, maybe 20 days, 30 days. And a system like 6,500 bed health system could lose about 100,000 nurse days just related to workplace violence, right? Again, we are being generous here, 1.2x regular rate for backfilling those nurses that are out of commission, but generally it would be in the 2 to 3x range. So when you calculate all of those dollars, you could save about $42 million annually in temp labor, in treating injuries, in workman's comp, in lawsuits, whatever would be associated with those out of commission days. And you could get about 4.5x ROI within 6 months of go live, right? So if you remember, I've mentioned rapid apps to unlock savings quickly can help you get to the next phase of value drivers, right? So once you prove yourselves, you prove to the leadership at the hospitals that this investment is making us some money, you can unlock other value drivers. You can identify some other use cases that IoT or Kontakt.io can deliver to further gain value out of it. So things that come to my mind when we talk about that is when you follow the pattern of staff members walking around the whole health system or the whole hospital, you will quickly identify, you will quickly map their journeys in their own shift, right? So, nurse comes in, goes to the nurse's station, does their morning routine, then starts doing the round. But you would quickly identify things like every few hours, nurses seem to be going 2 floors up or 2 floors down for something, and we don't know what that is. So once you start seeing a trend of these patterns of movement within the hospital, you can quickly try to identify what the issue is. So in one case at a large IDN, we figured there was a pattern of nurses traveling to one specific area every few hours, and that was reducing 40 minutes of their day in unproductive tasks. And then we figured out there was a supplies closet over there, which had some critical supplies that were needed for patient care on another floor. And by simply moving that supplies closet closer to the point of care, we saved minutes per shift for these nurses, right? And and that was not the entry level use case. The entry level use case was, of course, staff duress. But we figured that by calculating these trends, identifying these trends, we could do so much more by like saving time for these nurses. Another example is hand hygiene. So entry level use case is staff duress, but now by enabling the hand sanitization dispensers with readers that can track the nurse's usage of the hand hygiene stations, we are able to provide the compliance rate for these nurses, right? So we can track month over month how many wash cycles are happening. Maybe we start in January 2023 with 70% hand washing compliance, and then we see it dip in February and March to 50%, and we can kind of help use that data to educate the nurses to improve their hand hygiene compliance, right? So, and you can even track how hand hygiene affects HAIs. So if you are tied into the data from the EMR, which tells you increase in length of stay due to HAIs, or even, God forbid, deaths resulting from HAIs, you can tie that data right back to the hand hygiene. And you can see that improvement in hand hygiene is reducing the HAIs and patient deaths and improving reimbursements altogether. And this was not possible if you had siloed data. It is possible only when you are using openness of data sharing within the systems of the hospital, and tying all those things back to actual efforts in reducing HAIs. So like I mentioned, you can start small, you can start with rapid apps that can drive adoption, but you can quickly uncover other value drivers which will pay back significantly more than what you started with as an entry level use case. Just looking at time over here, I think we do have some more time. Then finally, modernizing data consumption. So I always get asked in my sales calls, hey, what kind of reporting do you have? Do you allow us to write SQL scripts to your database? Who owns the data? Those kinds of questions. And we are so way ahead of all that on the curve, right? We are integrating with OpenAI, where OpenAI is kind of doing the data crunching and humanizing the information rather than having to deal with business intelligence tools and writing SQL scripts. So using OpenAI, or commonly known as ChatGPT, we are providing with AI analytics within our apps itself. So you can ask simple questions like, where is my closest IV pump? What is the average utilization of my IV pumps in the last 3 months? Or name the top 10 nurses which spend the most amount of time with patients. And the AI chatbot will provide you with an answer right away, rather than having to worry about understanding the structure of the tables and data views and then coming up with SQL scripts to consume that data. So I think we are skipping a whole layer of manual reporting and going straight to using AI as the forefront of a digital concierge that provides humanized data and information at the fingertips, rather than worrying about how to utilize a data scientist to provide the reports you need. So in summary, you start small, you start with applications that provide value within 6 months. If you start at a spot where the value is not realized rapidly, then the adoption takes a much longer time. So you start with areas like the equipment management with staff duress, and provide immediate return of investment and value. And then once you are incumbent, once you know how the system works, you can start uncovering other value drivers, like I mentioned. And of course, utilizing modern technologies like the AI, like Chat GPT type functions, you can increase the adoption even more. And then finally, the openness of our systems, where we are not siloing our data, we are actually integrating with other systems and providing value to those systems and gaining value from those systems. We keep the patient journey at the core of what we do, so that the patient never has to wait for equipment. The patient never has to wait for nurses to be seen for more than X amount of time. And when their labs are due, there is resources available in the labs so that they don't have to wait to get checked or blood drawn or whatever. And they walk away from the health system with an amazing experience that results in better HCAP scores and more reimbursement. So with that, Daniel, I would give it back to you and see if there are any questions I could help answer.
Sure thing. Sounds great. Thank you so much, Kapil, for a really great presentation today. And as you mentioned, we'll now begin today's question and answer session. So to our audience members, thank you for submitting your questions so far. Please feel free to continue to submit questions by typing them into the Q&A chat box on your webinar console. And we'll go ahead and get started with the first question here. So Kapil, this first attendee wants to know, we have used IoT in the past, a huge investment, and a year later, our batteries are out and no significant impact on care delivery. How are things different today, seemingly different today than a year ago?
Yeah, absolutely. I think I may have a slide for that. Let me see. Yeah. So how are things different today? So in the past, the legacy systems, like how I would call IoT or RTLS legacy systems, they were very monopolistic. So they were hard to deploy. They required a lot of capex investment up front. They required certified technicians to go on site and install these, pull a bunch of cables for data and power, and had relatively very small battery lives on location sensors, or the tags as we commonly call it. So it was very difficult to deploy them in the beginning, and then also keep them maintained year after year. So they were, once you spend enough amount of professional services dollars up front and bring them in, it would work for the first 6 months amazingly well. But keeping them at that same performance levels year over year was the difficult task. And that's why in the previous era of this technology, it was easier to just abandon the system and go back to your previous ways of doing things, because maintaining those systems in addition to doing your full-time job was counterproductive. That's not what these systems are supposed to be doing. So in our case, we are providing fastest time to value. Anything from an infrastructure standpoint does not require cabling, does not require any electrical work whatsoever or construction work whatsoever. It's all plug and play or wireless. Secondly, we are using the Bluetooth low energy technology, which is out in more than 6 billion devices. And we are leveraging the R&D that goes into the Bluetooth technology, which makes it faster, smaller, more less battery consuming, devices. And on an average, any tags or any sensors we supply to our customers has 5 to 8 years of battery life. Whereas if you look at the older generation, they would just have maybe 2 years tops. But even 2 years were not achievable because of the kind of protocols of radio frequency they were using at that time. So things are different this time. The openness of our technology using open standard Bluetooth connectivity, better battery life, ease of deployment, ease of maintenance, just makes it a much simpler system now than it used to before.
Terrific. Thank you for addressing that question. This next attendee wants to know, we are using capacity management and CMMS systems. Do we need to change?
No, not at all. And that's the point I was trying to make through the presentation. You do not need to change any of your existing systems because of our openness in integration. We have open AIs. We can do web stream. We can do web hooks. We can do REST API. We can do file transfer. There's no limit to how we can integrate with existing systems. In fact, we can improve the value that you receive from these systems by our openness to integrate with them, right? So let's take an example of CMMS. We can import what the preventative maintenance dates are for your different medical devices, and we can track them within our system. And you can filter by the current PM dates required on our devices, and just give you a subset of devices and their current location, rather than having to do the mapping between the CMMS and our system to figure out where those devices are, right? And on the flip side, we can provide the real-time location and usage status to the CMMS. So you can incorporate things like depreciation, alternative equipment maintenance programs rather than preventative maintenance. And you can drive efficiency within your CMMS using the location and usage data that we are supplying. So it's very open-ended, and you do not require to change any of your existing systems. We only enrich them with our openness.
Wonderful, thank you. And it looks like we have time for just one more question. This attendee wants to know about the mobile experience. So can you talk about mobile experience and integration of mobile screens into the experience?
Yeah, so mobile experience, there are two things we can do. On the patient side, we are, like I mentioned, we are providing with wayfinding applications which are standalone, but we can also integrate with existing EMR apps like MyChart, for example. So in MyChart, we can provide maps that can help with navigation. But that's just one aspect of mobile, right? But on the administrative side, we are also trying to make mobile the hero, right? Like think of your security guards. They are not tethered to a station when there is an issue with workplace violence. They are on the go. So we are providing alerts on their mobile devices so that they can quickly address the situations rather than having to go back to their control center. Same thing with patient transporters or equipment transporters. We don't. These people are on the go. They're always moving around, trying to make things operate in a timely manner. We don't want to tether them with a workstation. So we are enabling their mobile phones with information of where work is needed, where there is a replenishment of clean IV pumps needed, where is a soiled IV pump pickup needed, where are wheelchairs being depleted. If there is a patient discharge, we can tell them like, patient transporter, you are the closest to this patient discharge, so you are the one who's going to go and help with that patient discharge. So we're using mobile as an organic device that just plugs into the rest of our ecosystem in our offerings, right? It's not a separate device. It just becomes part of the entire ecosystem, and it becomes an important tool that helps with driving efficiency.
Wonderful. Thank you so much. And that is all the time that we have for today. So I want to thank Kapil for an excellent discussion today, as well as Kontakt.io for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console, and please take just a moment to fill out our post-webinar survey. Thank you for joining us today, and we hope you have a wonderful afternoon.
Thank you, Daniel.